Hello, I am Dr. Raghav Dutt. I am a practicing spine surgeon at Udai Omni Hospital, Hyderabad. We have treated and treating innumerable number of children with scoliosis and kyphotic deformities of the spine. When these children come to us, sometimes they present very late. They sometimes come when the scoliosis has become very rigid. The next question is, how late is late? Sometimes when a child comes to us at 3 years of age, that itself is a long delay. Sometimes we treat these children very early as 9-10 months after birth. We put them in braces. The problem is, when we ask the parents, why did you come so late? They say that nobody told us that our child has a spinal deformity. We've been going to our pediatricians, they never told us, and when we saw our baby, we never found that our child has a deformity. This is a problem because sometimes, even if you bring your child to us at the age of 5, as I said before, this could be too late. There are simple ways of diagnosing this condition. Today, by doing very inexpensive blood tests at 6 weeks of pregnancy and again at 12 weeks of pregnancy, we can diagnose spinal disorders. So, I'm repeating this. As early as 6 weeks and at 12 weeks, inexpensive blood tests can diagnose to a large extent if the child or the baby has a spinal deformity. Most of the ultrasounds are done when the mother is pregnant by gynecologists. But gynecologists are not trained to look at congenital heart diseases. If there are problems with the kidneys, or if there are anomalies in the spine of this unborn baby. This is done by radiologists who are trained to do ultrasound examination of pregnant women. These radiologists or sonologists or neonatal sonologists should be doing ultrasounds at regular intervals. This is a very inexpensive test and done within 5 to 10 minutes by an experienced ultrasonologist. So you must request your gynecologist to refer the pregnant lady so that they check and they can give you information whether the child has a deformity or not. And they will also tell you how frequently these tests are to be carried out. So please get the pregnant ladies in your family checked by these specialist doctors, and they are available at every major hospital in Hyderabad and in big diagnostic centers in Hyderabad. It's important that the minute a diagnosis is made, these babies, the newborn children, should be referred to the scoliosis surgeon. Please do not get X-rays done. They cause unnecessary radiation to the newborn child. They should always be seen by the scoliosis surgeons who practice pediatric scoliosis deformity corrections, and these doctors will do the right X-ray and will tell you when it is to be done and how frequently these X-rays to be done. And this way, we can minimize radiation risk to these children. The spine can bend to the side, or the child's spine can bend forwards. When it bends to the side, like in this child, we call it scoliosis. When it bends forward the spine, that deformity is called kyphosis. Sometimes you have a mix of both scoliosis and kyphosis, what we call kyphoscoliosis. These disorders when they happen in childhood. Some of them happen when the child is in the mother's womb. And we can diagnose these conditions today with the help of ultrasonologists when the baby is in the mother's womb. Why is it important to diagnose them so early? Because the treatments of these conditions should start as early as 9 to 10 months of age. When we give them braces, we can correct the deformity to a large extent, and sometimes in some of these deformities, we can slow down the progress of these deformities with the use of plaster casts and braces. Now you see a child here. This child, when they presented to us, had a curve of about 20 degrees in 2018. Now look at this child here. When she came to our outpatients, she was already 8 years old and she had a curvature of about 20 degrees in 2018. And this child did not come for follow-up, and then she again came in 2022, and you can see that the curve has progressed to about 30 degrees. Again we suggested treatment, and now they are ready for treatment, but you can see here that the curve now has progressed in 2025 to 32 degrees. So a lot of these curves, with the use of simple braces, these are plastic supports that we make. These have to be done in a very scientific way. And once these braces are fitted to the children, a lot of this progression of the curve can be prevented. And once they come to 32 degrees, that means the child is now going towards surgery. So in conclusion, whenever a lady is pregnant, she should be referred to a neonatal ultrasonologist, should get very inexpensive blood tests, and after they are born, you must request your pediatrician to check the baby's spine. And also, the mother and the grandmother or the nanny looking after the baby who gives a bath should gently examine the child, and if they find a tuft of hair or a dimple or any deviation of the spine from normal, please visit your nearest scoliosis surgeon. Should you need further information, do contact our website as well as our YouTube channels.